All right, well, good morning, everybody, and again, welcome to our Division of Behavioral Health Centralized Data System training, and really today's focus is on question and answer. And so I've muted all of the lines, I know that we've got a number of folks who are on, and that's been kind of a nice way to be able to collect questions in past trainings, and so we'll continue to use that feature here. But this is part 3. We've had 2 other trainings, really introductions to this Medicaid eligibility feed that has begun going into our centralized data system. And so today we're going to walk through again for folks who maybe weren't able to join the other 2 trainings that we had, most recently part 2 last week. Those are up and in the system documentation training section of the CDS, and so you are welcome to go in and review those trainings. Today's training and question and answer session is also going to be recorded. Additionally, we are working with Medicaid and with the Heritage Health Plans, and we will be putting together an FAQ, a frequently asked question document, that will be sent out and will also become available in the system documentation and training section of the CDS. So I'm going to go through and again just give some high-level information and some reminders that have been brought forward in the past trainings. So again, just starting off with a thank you for joining us. As we had mentioned last week, we had an anticipated start date of August 14th, which was this past Monday. In order to get everything up and running, it actually became active on August 16th. So yesterday morning it became live, and folks, if you went in and you had anyone who was or is Medicaid eligible, would begin seeing then that notification within the CDS. Also, there would be a block from the authorization for or admission for anyone who's Medicaid eligible. So that has begun in the CDS, and again, that became effective yesterday, August 16th. And so just a couple of reminders that as we are approaching the billing week in September for your August billings, you're going to want to make sure that you're getting in and being timely with your review of this information to be able to be taking those steps necessary in order to back out units on your TADs from August or previous months, and also make sure that you are ensuring that the appropriate process for being able to get your Medicaid eligible folks set up with the Medicaid health plan that they select, also having that step completed. So again, thank you for dialing in and participating today with us. Again, I'll just give a bit of brief background for folks who maybe weren't able to attend the first 2 trainings. So the agencies and the locations that are going to be impacted are those who are a Medicaid-approved provider. All of this is being done at a provider location, so it's not at like the parent organization or the agency level, but it really comes down to the specific provider location. And it's all of those services that could be paid by Medicaid or could be paid through the regions with Division of Behavioral Health funding. So again, thinking about what those shared services might be, if there's a service that Medicaid does not pay for, this does not impact those services, but it is just specific to those Medicaid shared services with the Division of Behavioral Health. So how this will work, or how it is working, is we've got files that we actually receive from Medicaid, and they are the same files that are shared with the Heritage Health Plans. One is on the provider side, and the provider information for those Medicaid-approved providers. The other is the consumer file. So again, these are the same file feeds that the Heritage Health Plans receive on those individuals who are Medicaid eligible. That information is then matched up within the CDS based both on that provider location and also then on the consumer. So just a reminder of the shared services that we and Medicaid both fund. So these would be the impacted services as defined in DBH language. And so you can see here we've got a list of authorized services, those services that require an authorization before an individual can be admitted in order to be able to speak to that clinical symptomology or the requirements per ASAM in order to be able to attain that authorization approval. And then we have our registered services that don't have the questionnaire and the same authorization process, but do have individuals who may be admitted into the service. So again, this is a listing of the impacted services in which you might see or have blocks for Medicaid eligible consumers that would prevent you or would need to have you go in to discharge them from the CDS if it is found and determined that they are in fact Medicaid eligible. The different checkpoints that we have, again, at authorization, at admission, this also applies to any continued care review or continued stay review that would take place on authorizations, and then of course on the monthly tags on the turnaround documents. And so for those units that would be in place for anyone who was currently known to be within that service as they had not been discharged or their discharge was during the month, would be listed on that tag. So I mentioned that we have a provider file of all the Medicaid approved providers. And so the information that's used to be able to do the match for all of the providers who are Medicaid approved, we do need this information to be put into the EBS. For folks to be able to go into the EBS and to check this information, you'll be wanting to work with anyone who does billing and processing for the Medicaid file, as likely they would have more direct knowledge of and can confirm the taxonomy and the NPI that is applicable for that provider location. Additionally, there's a ZIP +4 digit that is now inserted into the EBS. So those three fields have been added into the provider location information along with the name as well as the location, so the address. And so you'll see these new fields. So we do need for folks to get into the EBS to enter in any missing information that might be there, or if there is information that you believe is in error, to let us know and to be able to work through the EBS email to be able to put those alerts into place. So again, just a reminder of what some of these alerts or notices would look like. On the authorization side, it would actually come up as a denial due to the Medicaid eligibility, and it would give the date that that individual had begun with their eligibility. Part of the file feed on the consumer side, as well as the provider side, are start and end dates as applicable. And then on the tabs, it would look like this. For this individual is no authorization, and that would have to do with the authorization approval. But you can see also where it says this consumer is Medicaid eligible and no tags can be submitted. So that would be the alert for individuals that, again, effective yesterday, you would begin seeing for any of those Medicaid eligible individuals in the shared services. So for those, one of the things that it becomes just shut down. So knowing that there's likely to be some cleanup in areas in which individuals will need to go back to past months of the tags that had been previously submitted to the Division of Behavioral Health, we have been working through with our vendor being able to create a process that will allow for those units to be backed out. And so what it will look like, and we've got this in the test environment now and working through tests, but will be rolled out to production so that you would be able to go back and you would still see that kind of pink or red notification for those Medicaid consumers. However, this will then allow you to zero out those units that previously had been submitted, so that way that updated information actually gets submitted to the EBS, to the Electronic Biling System, and can then be reconciled on that side. And so you'll see here the note, these can only be reduced. You cannot add new units on future months tags for those individuals as the eligibility might extend out to. They can only be reduced, but this feature will allow you to be able to go back. And so again, we're working through the testing of that and then expect to have that rolled out into production. We'll send out a notification once that is in place, which will allow you to go back to tags, but please do go ahead and get into the CDS and look at the tags for each of your services that you have access to be able to be working on those steps of getting the appropriate Medicaid authorizations or approvals and admissions completed. And again, I know this has been an expectation, and so this isn't new expectations, but just a reminder that it's extremely important to be checking the C1, the NIMS line, and on an ongoing basis, be aware of what that Medicaid eligibility for the consumers in your services and what those changes might look like. If you do, in fact, have individuals who had previously been in the CDS, again, you'll want to back those units out once this temporary kind of fix of that gets put into place. The other important thing is that you actually then go through the process of discharging the individual and going through the steps to admit them with the Heritage Health Plan of the consumer's choice, but that you discharge them from the CDS and you update any relevant information with the most up-to-date information for that individual. And then for the discharge type, you will actually be selecting change of payer source. And again, this is the message that you'll be seeing on there. The units for Medicaid eligible consumer, or encounters rather, can only be decreased, not increased, or changed to a different service detail. So a reminder, this week, get into the CDS, look at your tags, both for this month, for the past several months, to be aware of where those instances are that as soon as the option to be able to reduce those units would impact your tag. Also, notify us of any questions or concerns. Our next slide has CDS contact points. And so, again, just using those to be able to alert us as to any issues that you might be having, concerns or questions. We'll be working with Medicaid and also through them with the Heritage Health Plans to put together that frequently asked question document. So your concerns and questions and the issues will help us to be able to add to that frequently asked question document, as well as be able to think about any type of override for exceptions that may need to be put into place eventually, as well as being able to identify resolution for any issues in the system now, so that that way, come billing week, all of that has been resolved and you're able to complete your billings in a timely fashion and you're not running into issues or barriers with being able to complete that. Also, it will assist in being able to develop different reports that we might need in the system at the division level or at the region level, potentially different things at the provider level. So again, we're using that information from you all as we're thinking through and crafting those different resolution and solutions, as well as the reports that would be generated. So here's just again a reminder of different contact points and ways in which you can report those issues and just alert us to those questions or issues as they come up. So with that, I'm going to open it up, and if you have any questions that you have, we've got a group here that we will do the best of our ability to be able to address your questions today, or at least have these questions help to guide the development of that frequently asked questions document, so that that way the message that we're offering to you is consistent with what Heritage Health and Medicaid would want to alert you to as well. So again, we'll be doing that in collaboration with them. So if you have questions that we're not able to address from our Division of Behavioral Health staff, we'll make sure to be able to tie those in and be able to have the appropriate steps or information that's available to you. So we'll stay on the line, and again, if you have questions that you'd like for us to address or to have included so that that way we can work through them, please type those into the chat box. We've had a question that's come in related to where at in the EBS providers can go to check their NPIs. Pat Roberts just stepped out, and she's going to go take a peek in the EBS to ensure that on the reports feature that information is where you would go. So we'll have an answer from her here momentarily. So Pat Roberts has stepped back in, and we have another question for her as well. But the first question that we had related to how to go in and to check or to view and to be able to be aware if there's missing NPI information for you. Pat has confirmed that there's not a report right now, but we will work on getting a resolution to that and having a way to be able to notify you of missing information and then also a way to be able to confirm the information that's there. So that will be forthcoming. The next question that we have, Pat, is a web address for the EBS site.
It is http://ebs-dhhs.ne.gov. And you do need to have access prior before signing into the system.
Thank you for the message there about the EBS. It is, in fact, https and then : / So that's been updated now. Thank you. So another question about where to find the NPI taxonomy and the ZIP +4. And I apologize, I had thought that providers have access to the provider name, the address, and the page in which those contracts are loaded and that information is stored. Pat has indicated that providers do not, in fact, have that, that's behind the scenes. And so we will be working on a way to be able to get the information out to you regarding missing taxonomy and NPI, as well as the information to be able to verify those codes. So likely right now we're probably either looking at sending out a spreadsheet of the information that we had been able to collect and include out to the EBS users, so that way those in your billing area will be able to confirm that information and then get back to us any updates or any new information to include.
I know. Hi, this is Pat Roberts, and I'm just going to confirm that later by the end of the week, I'll be sending that information to the fiscal managers that will be reaching out to the providers to send that, so that you have the contact and you can, if there's a question or a correction, that you can go through the regions and then they will let us know, and then we can reach out to the Medicaid to have the files corrected.
And just to further clarify on the NPI and taxonomy and really the confirmation where that information exists, some locations might have specific numbers that are for a clinician versus the location at large. And so we want to make sure that we have, in fact, selected the appropriate NPI and taxonomy for the location at large. So again, just to confirm that that's kind of the information that we're looking at, but in Pat's note to the fiscal managers, we'll make sure to include instruction about what it is that we'll be wanting for additional information to come in, or also for that confirmation, so that way folks are clear on that. All right, well, we've not received any questions here for quite a few minutes, so I will take a last call for any questions that you have today. Again, if we're not able to answer that question today, we'll make sure to be able to get that information pulled together and out to you. So last call for any questions on the Medicaid eligibility feed into CDS. All right, well, we're going to go ahead and shut down today's call. Thank you so much, everybody, for joining. We'll get the recording up onto the system documentation for anyone in your agency who may not have been able to attend today, though I don't know that we presented a lot of new information or anything other than with the EBS, but again, that'll be forthcoming by the end of the week, and so you can expect some instruction and some follow-up steps through your fiscal managers in the next week or so, I would imagine. But anyways, again, thank you so much. Oh, we do have a question that's come in. Can you clarify what share of cost eligibility will look like in CDS once the share of cost is met? So for share of cost related to Medicaid, that's Medicaid eligible, and DVH does not pay share of cost. So the share of cost, as my understanding is the responsibility of the individual per the Medicaid kind of criteria and expectations, but they are Medicaid eligible and they are not eligible for Division of Behavioral Health funding. So we've had another question that's come in. Will the eligibility notification look any different just because it is a share of cost client? No, Medicaid eligible consumers come across regardless of whether they have a share of cost or not. Again, that's all determined by Medicaid. they're a Medicaid eligible consumer and therefore not able to receive Division of Behavioral Health funding for that service. All right, we've had another question come in. In looking at past TADs, reports that now show a client is Medicaid eligible, the individual is not seeing where they can enter a 0 to credit back the units on the TAD reports because that field is pinked out. How do you do that then? So that is correct. Right now, there is not the feature that I had showed you, and we have this in test, and we are working with our vendor to be able to get it in place. But once this gets rolled out, you will be able to 0 out those units. And we expect that this will likely take place next week, that feature will be there. So again, we'll send a message out alerting you to the fact when that is available to 0 out those TADs so that you can begin to get in there and do those activities. But you are correct that right now how it's set up, it's just a block. So again, kind of thinking about your activities for this week, getting in, having a sense of who those Medicaid eligible consumers might be, and start working on those activities to be getting the Medicaid information in place and getting them switched over to any plans as would be needed. And then once that, the option to be able to 0 out those TADs becomes effective in the production environment, we will send a notice out through the listserv so that way you are aware that that is now in place in production, and you can go in and start to resolve those TADs that need to have 0 units submitted over to EBS. All right, so we've had another question just wanting to be able to clarify on the share of costs. So for Medicaid eligibles, for individuals that are Medicaid eligible, that will come across, and they will be the individuals where there will be those restrictions for authorization, for admission, for any continued care reviews or continued stay reviews, as well as on the TADs. Those are individuals who DBH will not be able to be billed for, and so if Medicaid has determined that that individual has a share of cost, that responsibility goes on the individual. It cannot be paid through the region through Division of Behavioral Health funding. That is a Medicaid eligible person, and that share of cost determination is on the Medicaid side and will need to be worked through with them. I know that they have a different appeals process that an individual could take through appeals if they do not agree with the share of cost. But again, we'll pull information into the FAQ as we work with the Heritage Health plans and with Medicaid, because there might be differences in how they approach that or how they would want to instruct you. But again, just to reiterate, for Medicaid individuals who have a share of cost, the expectation is the same, and that any past units of TADs would be 0'd out and repaid because Division of Behavioral Health funding should not be used to cover any part of that service cost for those Medicaid eligible individuals. All right, another question or clarification, wondering about if the Medicaid eligibility for share of cost will look different than other Medicaid eligibility. All of the alerts and all of the messages are the same, regardless of if it's share of cost or just any other type of Medicaid eligible. So there's no specific designation or indication of the share of cost piece. That being said, just also to clarify, these alerts are only within the Centralized Data System. They are not within the Electronic Biling System. So one further clarification, just given the questions about who will have this alert or notice or on the TADs, what might be indicated. I will say that this is not a 100% perfect system, nor should it ever replace that check in the Medicaid systems that are going to be your primary and your first check and kind of your go-to source of accuracy and of all of the information on Medicaid eligibility. So checking that NIMS line and the C1 is the expectation, and that even if someone isn't coming up in the CDS with that information blocked, it is still your responsibility to charge Medicaid and to go through the Medicaid steps if they are Medicaid eligible, irregardless of whether or not the CDS has alerted you to that. This is sort of a check to be able to complement those, but it is not a replacement for that, nor is it going to be, in all cases, 100% accurate with that information. So again, just to reiterate, the first point of always checking that Medicaid eligibility should be the C1, the NIMS line, any source of information on Medicaid eligibility that is directly given from Medicaid itself. So there's a question about what happens when the NIMS line says that the individual is not eligible, but the CDS says that they are. You would want to make sure that you go through and check with Medicaid. And again, if the NIMS line is saying that they're not being able to follow up with Medicaid, but the information on the CDS side is directly derived from the Medicaid file, which comes from the same source, which is Medicaid, as the NIMS and the C1. So it should never be the case that an individual would be designated as Medicaid eligible unless that was the case in the Medicaid eligibility file. And so one other thing to note about sort of the consistency between what you might be understanding from the NIMS line versus what might be displayed in the CDS. Again, that NIMS is always that primary source of information for you to use, or the C1. But that being said, there could be some programming glitch, and so if you are seeing inconsistencies, please do alert us to that so that that way if there's some type of systematic issue that's occurring with the file feed, we'd be able to get a resolution in place for that. Additionally, because the information comes from that source, there could be delays. So the NIMS line could have more accurate and up-to-date information than is yet understood or seen in the CDS. So again, the importance of the NIMS and the C1 being your first and your primary area that you would be going to be able to have the updated information on that. For the consumer eligibility, those files are sent daily, Monday through Saturday, and then on Sunday, if Sunday is the last day of the month, the daily file is any new or changed information that might occur. And so again, there could be a delay, but typically we would not expect for it to be more than a 24-hour delay. And then on the last day of the month is a full replacement set of information. We've had another question that's come in, so just a moment. And just kind of as a general note, if there are issues or if there is some type of conflicting information that you find, again, please use the contacts to be able to alert us to that. Within the CDS, there is a report a data issue in which you would be able to, for that specific encounter, give us any type of notification or alert or concerns that you might have. And again, then we'll be able to track that by the specific encounter. So that would be another mechanism in which you could use if there are issues that are coming up that are consumer specific. All right, well, we are coming to the end of our time today, and I've not gotten any more questions. And so again, thank you everybody so much for joining us today on the call, as well as for your work to get in, check your tags, and again, just making sure that things are getting cleaned up before your billing so you don't run into any delays in getting paid. All right, thanks so much, everybody, and we look forward to the next time that we have a training. Take care. Bye-bye.